This program is brought to you by American Oncology Institute at Babina Specialty Hospital, Sajiwa, Imphal East.
Mayam Krumzari don Ingrid Basi Impact News ni ai Joyshree Usham na Impact News ki Impact Health Link for a Healthy Manipur program se taram nokchari. Akoy na chayo khuding gi sanokchari ba program sida tongan ba laina laiwong sing adagi medical gi lamda kari kari anobo advancement le ribage haibadu lamda masigi miyam da khangan na bagi pandam da sandokcha ba Impact News ki Health Link program ni ngasi akoy na pujargli ba topic asi yamna anobo topic habatare nuclear medicine asigi matang dani loina na expert oin election biriba sina Andhra Pradesh tagi Dr. Revanth Kumar Hauzigna Consultant Nuclear Medicine American Oncology Institute at Babina Specialty Hospital, Khabeisoi, Jail Road, Imphal, MBBS, a Diploma in Radiation Medicine. Welcome, Doctor, to our show. Thank you so much for taking the time to be with us here today.
Yeah.
Now, the first obvious question is, what is nuclear medicine? Because we have heard about what is nuclear weapon and all that destructive thing, but nuclear medicine is something for the welfare of mankind. So please kindly elaborate what is nuclear medicine.
Nuclear medicine is a branch of the science, means it is a highly technical branch of the science, which we use very little amount of radioactivity will be given to the patient, and it is used to diagnose the cancers.
Okay, so the radioactive, it's applied to the human body to diagnose?
No, I will be telling how it will be given.
So this is a field of medicine which will help many patients, especially cancer patients.
Especially cancer patients.
Okay, so could you please tell us a little bit about the history of nuclear medicine as well?
Nuclear medicine was a very old branch, but before that, nowadays it is coming to the, it is a very uprising branch nowadays, which very young doctors are coming and taking the studies, and who are coming forward, exposed to the radiation, and to do the service for the patients. And in India, first nuclear medicine department was started in INMAS, Institute of Nuclear Medicine and Allied Sciences in Delhi. From there, INMAS is the first institute which brought the nuclear medicine into the light in India. Then after, every famous central institute like AIIMS, PJ Chandigarh, all the very famous government, well-known government colleges which are good at servicing the for the people. That's why nuclear medicine is, it plays a very important role in the treating the patients.
Okay, and then what is the main principle behind nuclear medicine?
See, the principle is, in nuclear medicine we will be giving the radioactivity to the patient, and after giving the such a can I get the order, please?
What
pressure?
Okay.
And it is uptaken. It will be uptaken by the specific target organ in the body.
Okay.
After that, we will be keeping the patient on the gamma camera or PET CT scan, which image is taken by the detectors through the camera missions.
So, doctor, there are many other diagnostic tools through which we can detect the origin of the disease. So, what is so different about nuclear medicine? Is it because it uses a radiotype radioactivity?
Exactly. Actually, it is different from other branches because in nuclear medicine we will be using the unsealed source, which will be given to the particular patient. In some other branches, for example, in radiology, from the patient there is patient is not the source, but in nuclear medicine we will be injecting or we will be giving that radioactivity in different forms. It can be for the small babies, we will be giving the milk. For any female, for thyroid patients, we will be giving in the blood. To see any swellings in the leg, we will be giving through intradermal. There are different ways to give the radioactivity to the patient, radioactivity very small amount to the patient, and we will be taking them to the in front of the camera, and then we will take the scans.
So coming to the next question, so you have highlighted about the difference, but I want you to highlight it little bit more again between the primary difference between
The
nuclear
primary
medicine and radiology.
The primary difference is in nuclear medicine, the patient after patient itself is the source
Of the radio.
of the radiation.
Radiation.
The source comes out from his body and hit the detector, and it will be taken as the image.
Okay.
In radiology, for example CT, the radiation is external.
Okay.
The main difference is in nuclear medicine the patient is the source. In radiology, external radiation will be there.
Okay, so briefing once again. In nuclear medicine, the patient, the body itself is the source of the radioactive, or what do you say?
Source.
A source.
Because we are giving the radioactivity in a few different ways. For some, it depends upon our indication. Means for the small babies, we'll give them through the milk. There is a scan called milk scan.
Okay.
And for thyroid scan, for that we will be giving the IV.
Okay.
And for lymphoscintigraphy scan, we will be giving through the intradermal. So there are different methods and of administrating the radioactivity to the different patients.
Okay. Thank you so much. And now I would like to know why do doctors use nuclear medicine? What is the importance of nuclear medicine, since we have radiology also, so many other methods of diagnosing disease? Why do doctors prefer nuclear medicine? What is the specialty about nuclear medicine?
In the radiology and nuclear medicine are there to diagnose the cancers.
Okay.
In nuclear medicine, there is something called nuclear therapy, which not only useful in the diagnosing and also very useful in the therapy.
Okay.
For example, for the thyroid cancer, we will be giving the radioiodine, and it will kill the cancer cells in the body. So this is the reason will be, and also it is in nuclear medicine mostly we will be doing the in single scan from head to toe or head to mid thigh. It depends upon the protocol and the cancer of the patients in one go. If we are giving the radioactivity, for example, a cancer patient is there, for them we want to know everything was done, all the investigations are done, still they have not diagnosed what is happening with him, because patient is having the right what is happening with him in his body.
There's something which cannot be detected by other method can be detected by nuclear medicine.
Nuclear medicine, after giving, we'll be going into the deep in the 30-minute span of time. Definitely, there is something called. There are lots of tracers. The mainly used tracer is FDG, which we will be using in our AOI institute also. We are giving FDG, and it is taken by the cancer cells, and it will tell where is the problem.
Okay.
In most of the out of 100 cases, nuclear medicine can detect what is the cancer in 33.
Okay. So the nuclear medicine and radiology, they are quite different.
There is no point in the comparison. Both are used for the welfare of the patient, but in the nuclear medicine, will be external radioactivity is given to the patient, which makes the diagnosis will be given.
Okay. Now, what are the different types of nuclear medicine?
Firstly, the scans which we will be doing in our institute AOI. First, for example, if we take a bone scan, in bone scan is used to detect cancers from, it might be from breast in the both females and males, breast cancer, prostate cancer. The activity which we will be giving to the in the bone scan, it will pick up the metabolism of the bone, means activity, osteoblastic activity, which is rapidly done in the bone. It will pick up and it will show. And this scan is also used in very other many indications, like if a young guy he was playing cricket or whatever things, he might be having pain, stress fracture. It is called a stress fracture. And middle-aged women having the joint pains, for that it is called arthritis. We can detect, we can do the diagnosis of the arthritis. For any patients, after doing any surgery, processes will be there, and whether it is to see whether it is loosening or infective, it is used. And also ectopic calcification, it can be seen in the bone scan. Nothing can replace the bone scan, because it will take the metabolic osteoblastic activity in the bone, and it will shown in the images. Then the physician, the particular physician who is sending the patient to the doctor, he will be it will plays a main role for him to give to in the diagnosis, in the treatment.
Okay, for the bone scan.
Yeah, bone scan.
Now there are also different other types of
There are
scan.
also different other scans.
What are they?
There is, thyroid scan is there.
So how do you do thyroid scan with this nuclear medicine?
Thyroid scan, there is hypothyroidism and hyperthyroidism are there. Means in hypo, both are just opposite to each other. In suddenly a woman, middle-aged woman, suddenly her weight is increasing the weight, and irregular menses, and her obesity. These all are comes under the hypothyroidism. It has to be treated as soon as possible, as detected. If it is not treated, it will leads to the so much. It will decrease the quality of the life of the patient. So, in hyperthyroidism, it can be in males and females. Suddenly, in spite of having the good diet, the weight will be coming less, and they will be having the tremors. Whenever they are working, for example, a lady is making the cooking in the kitchen, she might be having the tremors. And hair fall, and they can't spend so much time in the heat. It is called as a heat sensitivity. For these things, the thyroid scan is done. It will tell the functional working of the thyroid. What is the status of it? Is hyper functioning, or it is low hyper functioning or not? It will tell. And this again, this will be giving this gives an indication for the clinician to treat the patients. And so, also thyroid scan is done to detect ectopic thyroid.
What is ectopic thyroid?
Ectopic thyroid means for everyone it will be here in the neck. For some people it can't be here. It might be under the tongue. It might be there. So to detect those things.
So under nuclear medicine, you can detect variety of different types of diseases, like thyroid is there.
Thyroid
you
is
have
bone
mentioned
scan.
thyroid, bone also. Then what I've seen is what is a renal DTPA scan?
This is for this scan, DTPA scan. This radiopharmacy will be given to the patient through the IV. In the bone also IV, thyroid also IV. It will be given in the IV, and it will tell split function of the kidney. Means, for example, right kidney, left kidney is there, and it will tell how they are functioning. This is a functional test which can be done in the only nuclear medicine department. It cannot be done in other departments.
Okay, this renal DTPA.
Yeah, it is used how the kidneys are working. For example, if patient has undergone kidney transplant, and the physician after doing the surgeon has did the kidney transplant, and he wants to know whether the kidney's function is not. Kidney function is given by GFR, means glomerular filtration rate. So it can tell.
So only it is under nuclear medicine.
It is under the nuclear medicine.
No other way.
No other branch. We are doing in AVO, we are doing this DTPS scan very frequently, and we will be giving. Lots of patients are coming. Means for the patient, if especially in the families, mothers will be donating the kidneys, their whatever, their son, husband, brother, whatever. So before taking a patient to the operation theater for the donor as a donor kidney. So before taking the kidney from the body, physician needs to know what is the functioning status of that kidney.
And that can be known through this nuclear medicine. This particular renal DTPA scan.
Yeah, personal renal DTPA. After transplant also, after keeping kidney went from one person to other person in the family. So now physician wants to see how the kidney is working after transplant. Means before transplant and after transplant, DTP has a very important role.
Okay, so that means nuclear medicine is important not only for diagnosing or finding out the diseased part of the body, but it is also helpful in identifying the functioning of kidneys and other organs. Okay, thank you so much, doctor. We'll take a short commercial break.
Yeah,
now.
sure.
Attend ba commercial break ta logjagi break matung da nuclear medicine hariba asigi matang da amuka hana khanajagi.
Presto Personalized Wonders, Imphal da nauna hangdok cheri, Hairiba sida personalized gifts, corporate gifts, awards and mementos, home decor, office rubber stamp na chingba potlam sing mafam asida phangbigani ngasi maglangsing birau Tilagras Enterprises, Presto, Thangal Bazar near Kasturi Thong, Imphal. Contact number 0385-244-9025 natraga 98621-00456.
Honda Car India Limited na India's strong hybrid electric vehicle New City HEV Lakliba Methada all over India ki oina launch torgani. Hariba gari si high tech performance, advanced safety technology, Honda sensing, smart watch integration, Google Assistant, Alexa, lithium iron battery 8 years and 1600,000 kilometers battery pack warranty. Gari si ki mileage na 26.5 kilometer per liter oiri. Premium amadi equipment features kayama yauri. Pre-booking taubiba yargani. Akupa marol kidama Sangai Honda Showroom, Gari Airport Road, Imphal, Manipur amadi. Bizariba contact number 8657589079 da pau pauyo.
Break matung da amuka hana taram nokchari. Akhoi na ngasi khana zaram liba topic asi nuclear medicine haiba asi matang dani masi yamne advance hoiba khogi laina layong sing thidokpa diagnose tawba duga therapy da mating oigeda ba dukumba medical gi advancement ama lakpa galoina na dukumba makhal gi field amani haizaba tare ngasi akhina unazar ba Dr. C American Oncology Institute at Babina Specialty Hospital Khabeisoi Jail Road tagi consultant nuclear medicine Dr. Revanth Kumar gani. Doctor, welcome back after the break. Now before the break you have explained to us about renal DTPA scan, which is important to know the functioning of the kidneys before transplant, after transplant, as well as about thyroid scan and so many other things. Now we would like to know what is PET, positron emission tomography, and what are the benefits, because it also comes under nuclear medicine, right?
Positron emission tomography. It was means the basic is will be for any cancer patient. It might be any cancer, head and neck cancer, oral cancer, liver cancer. Every cancer cell is very hungry. So something it has to be given to feed them. So in this scan there is a specific tracer what we'll be using in American Oncology Institute, FDG, F18 FDG. By giving these things, all the hungry cancer cells they will take. That is called that will be measured in terms of SUV. It will be clearly shown in the console, and then we will be coming to know where all the cancer is there. For example, if it is in the breast cancer, it is in the breast cancer, and from where it is going. From the breast, it will goes to all the bones. Then there some per people it will be going to the liver. All those things can be
spreads.
It is called from one place. Cancer is in the primary site is the breast, and from there it is going to different part of the body. That is called metastasis.
Metastasis.
Yeah. Because breast cancer is one of the most common cancer in women. For all the cancers, FDG PET scan is can be done. There are lots of tracers for the brain disease. There are for Parkinsonism, people who might be having forgetting their memory and difficulty in talking and difficulty in walking. So something like I will tell two names, like Alzheimer's disease and Parkinson disease. For those things, there are different tracers are there which can be which can give which can tell where is the abnormality in the brain. And we'll talk about the PET CT. First I will tell some patients will come and they'll ask they got the new appointment for the PET CT, and then first we have to make the patients, this is a preparation for the PET CT scan. It cannot be done as like that. There is certain protocol which should be followed by the physicians and the nuclear technologist and the nurse who is working in the nuclear medicine department. They has to give a proper scheduling the patient. For the first thing is the patient should not have the food from 4 to 6 hours. They should not have the food, and they can drink good amount of water. The reason behind to drink good amount of water is by drinking water they get more hydrated. Then after if we give the FDG, it will goes to every part of the body, and it will be for example now the cancer is in breast cancer or lung cancer, so it will more taken by the lungs,
where the exact source,
where the exact source is there, and that can be seen. And while doing the scan, we'll be giving the IV contrast and oral contrast will be given for the patient. They have to drink water before the scan. And for example, any patient was lactating, means giving the milk to the children, and recently diagnosed pregnant women, these people are not allowed into the
PET scan.
Nuclear medicine region, because
entire nuclear
medicine they are not at all allowed.
Not allowed. Okay.
Because
something to keep in mind.
This should be always followed. Even though we are giving a very small dose of radioactivity for the benefit for the patient, still children's, they has to be under pregnancy. That was the more sensitive period in the especially the early period. so they should allow it. And these are the instructions what we'll be giving for the patients.
So following all this protocol, then you'll
This protocol has to be followed. There is no other way, because we are playing with someone can't play with radioactivity. So there is AERB, they has given certain guidelines and certain protocols should be followed for the welfare of the patient by giving the small amount of radioactivity, and it will be giving diagnosis at one time from head to toe. It will tell the primary and it will tell the distant meds. Means the thing is, nuclear medicine is a branch stands between a surgeon, a medical oncologist, radiation oncologist. This is nuclear medicine will stand between the patient and the surgeon. For example, surgeon, if the cancer is not the primary site, for example the breast, there is then he can do the surgery and take it out. At the same time, when it is already spread to different part, different bone, so now he will refer to the medical oncologist. So every PET scan, what we are doing in AOI has a very big role in deciding the detection of cancers and
for the process for treatment.
In the treatment, it plays a very good role in the treatment, and after treatment, follow up. Means how this certain patient is responding for certain type of chemotherapy.
So doctor, after the PET scan, the primary source and as well as the metastasis stage can also be known exactly with the PET scan.
Yeah.
So after that, let's say we have already identified a particular source, doctor has done the surgery, treatment has been done. Then after the follow-up also, the patient has to go through PET scan again. How many times the patient has to go through PET scan?
There is nothing called how many times a patient can go. There is something called in the literature surveillance period. Once the cancer came and the patient was treated with surgery or chemotherapy, he should be followed. It depends upon the surgeon. He may send, if the cancer is more dangerous, means I am telling in the normal language, it's more dangerous, so he will be he will be he will do the proper follow-up of the patient for every 6 months. It depends upon the cancer to cancer, 6 months or 1 year.
So won't it be, as you said before, as a though it can clearly show where the source is and it is very effective for identifying and even for therapy, but as you have mentioned before, for small children, I mean, being exposed to radioactive material may have some side effects. So what are the disadvantages or side effects of nuclear medicine?
Disadvantages means there is no document has made like that there are such a disadvantages. There is no proper document is not there. As it is, it should be proper document, means someone should study, means there is no ethical thing behind it, giving unnecessary radiation to someone and thinking how it runs bad. Unnecessarily giving the radiotherapy to the innocent people without any medical indication, it's a crime. So there is no such side effects, but there are little side effects. There is something called after giving radioiodine therapy, there might be swelling in the neck, or these are the short-term side effects.
Swelling
in the neck, tasting difference in the taste.
The difference taste sensation gets affected little bit.
They get dry cough, neck pain, and nausea, vomiting. These are the small side effects which will be recovered.
How long does it take to recover these side effects?
Every patient is different. Every immune system is different. It depends upon them, and these are not such a huge things to be worried about.
So this AOI Imphal at Babina specialty, and the hospital has all these nuclear medicine facility, or is it still in developing stage?
No, actually AOI is the dedicated oncology hospital, dedicated cancer hospital. So it is the first dedicated oncology hospital in the Manipur.
In Manipur, yes. First private hospital,
First
cancer
private
hospital.
And I think everything is there. They had the PET CT and they had the gamma camera, and now they are coming. I mean, we are coming with radioactive iodine therapy, which that plays a very crucial and important role in treating thyroid cancers.
Okay.
For example, in the population, 50% are female and 50% are male, and most of the thyroid cancers are mainly seen in the women. So, radioactive iodine is it should be given for the it should be given to the patient to treat the thyroid cancer. So we are coming up with already we are having infrastructure is very good, and for small children also we are doing especially blood cancer, which is frequently seen in the small children.
Okay.
That is in a medical term it is called lymphomas. For them also we are doing the PET CT scan.
Okay, for which will not have much side effect for small children in a proper manner.
No, it's not about the side effect. Means for an young adult only we are giving this little amount of dose of radioactivity. For the small kid we will be very we make sure that the amount of dose still should be reduced.
Okay.
And given to the 5 years kids, 6 years kids, so many patients will be there. So in AOI we used to we are doing small PET CT scans for lymphoma patients, breast cancer, colon cancer, rectal cancer, head and neck, and liver cancer. All the variety of patients we are doing our services to the people. And instead of this is the first dedicated oncology hospital in Manipur. It is something called development, what is happening in the Manipur. I can tell AOI is the new development and the recent development which was happened in Manipur.
Yes, definitely, Doctor. This is the first private cancer hospital in Manipur, and so many equipments, technologies are there in the hospital. And obviously, nuclear medicine is also one of the advanced, as you said, advanced and very advanced method of diagnosing, treating cancer patients.
It is have both diagnosis and
therapy. But when we come to the expenses part, it must also be very expensive, because good things don't come at cheap price, isn't it? So what do you say about the expenses? Is it very expensive? Can a common family afford this kind of nuclear medicine?
See, I can't comment upon the financial status of some other patients, but I don't think it is that expensive.
So like
I'll give us one very good example. For example, hypothetically speaking, a patient is having some lung cancer and he wants to get the treatment, and from here he wants to go to some other part. For example, Manipur patient, I don't know surrounding, he can go there. Means he has to spend money on his treatment first thing, and he has to spend the journey, and both it will be and also the patient is under stress. Compared to all those things, if they are coming to here, they are saving good amount of money, time, especially the stress. So I don't think the question is regarding to the expense.
No, so the point is life is more important than money. So if you are suffering from cancer and if you want to get the best treatment, then you have to undergo therapies, which might be expensive or not, because life is more precious than money.
I like to tell one thing to the people who are listening. If they have whatever cancer or sickness, in the initial stage, they has to come to the doctors. If they neglect and they come after some span of time, for example, a breast cancer patient, he came towards me after 2 or 3 years. By the time, it was already spread to other parts. When they are having a simple pain in the left breast, they should go and see the doctor immediately.
Right in the early stage.
Right in the early stage, there are so many investigations are there. Mammography is there, which ultrasound is there, which will detect the cancer when at the small stage.
Okay.
So whenever they are having something, they has to think seriously. Yes.
So early stage, it can be detected by other means, but in the later stage, then you have to
No,
use
the-
more advanced.
The point is not like that. My intention is telling they has to go to the doctor and they need to get the treatment
At the early stage,
At
as
the-
soon as
in the-
possible.
as soon as possible. In the early, if everything is in the, for example, every test is done, nothing is gone. This is something called carcinoma of unknown primary. Means even patient has no idea what is happening in him. Then we has to do full body, head to toe, PET CT scan.
Which will be obviously more expensive compared to the other ones, right?
I said
Comparatively, yeah.
I can't comment upon someone's financial status. So at that time, nuclear medicine is out of 100 cases, nuclear medicine will be giving 33 cases. They will be giving the diagnosing. Means it is telling you are having this problem. So it is. It depends. It is very recent hi-fi branch, and which can place the role, which plays important role in the diagnosing, and which plays an important role in the therapy.
Okay. Thank you so much, doctor. And definitely today's the topic is very vast, and nuclear medicine. It is not. I don't think it is. It was easy to explain this to us in this 30 minutes, because there's lots of medical terminology which you have studied for many years, and explaining all that in few minutes to be able to understand for the common people, it's not an easy task, but you have explained what is nuclear medicine very in a concise manner, and for that we really appreciate you. And from Impact News, we would like to present this memento sponsored by Presto Enterprises. So thank you so much, doctor.
Thank you very much.
Now we have come to the end of today's episode, and towards the end we would like to get some would you like to leave some message for our viewers?
That's what I think I already said. If you have something problem with yourself, a small lump in the breast or a small pain in the mouth, just don't neglect. You should not neglect. Be conscious and rush to our family doctor, physician, and because every person has the right what to know what is happening in their body. For that, there are many fields for there. In that field, my branch is one. Nuclear medicine branch is one.
Yes.
And I wish everyone should be having a good health. If something wrong, you have to face it. And I don't want someone to be with bad health. If they got something, get courage and go to the doctor and start the treatment. Just be strong and good.
Thank you so much, doctor. There are so many questions that we could have asked, but time is limited, and you have explained about your branch, your specialization, nuclear medicine. Thank you so much once again.
Yeah, thank you.
Thank you. Ngasigi Impact News ki manung Impact News ki Impact Health program asi matang shwai de loislakle. Ngasigi episode asida akhona nuclear medicine hariba yam advanced oiba akhoi cancer ogera to palaina ogera yam diagnose tauba therapy piba ngamba adugumba branch haibtare nuclear medicine ki matang da Dr. Revanth Kumar ga khangminakre aduga mathang ki chayol da to palaina amagi matang da expert ma pudan lakchige haraga miyam nagi kaina na bhaya thani jari. Thank you.
Shri Shri Gaurachandraya Namaha. Purwashram da aikoi khwaigi irakta laimin najaramba Sapam Monindro Singhana mahaki nusijaraba imung manung shagai natai marup